Hey guys, welcome back to the channel. Today I want to share with you a quick and easy taping method that I've used with some success for people who have trigger thumb. All you're going to need to make this work is a roll of sports tape, okay? Any brand will work, and some scissors. Okay, so the first thing that I'm going to do with the tape is go ahead and trim it back to the size that I need. For this tape in particular, I'm going to cut about 3 boxes. It doesn't have to be perfect, but you do want enough tape to kind of cover the front and the back of their thumb, plus a little bit of a tail. Okay, so I've got my 3 boxes cut here, my little rectangle. And I don't want a piece this big because that's not going to fit the thumb very well, right? So I'm going to cut it up the middle, okay? So right up this direction. You probably can see a little bit better this way. I'm going to cut kind of lengthwise in half. So I'm just going to cut that. Okay. All right, so I've got my little strip. And then we know that the tape isn't going to stick as well if you've got square edges, so you're going to round the edges just so they contour a little bit better to the thumb, and stick a little bit longer. And what we're doing today, kind of with this tape, is we're actually creating like a little inhibitory effect or kind of some proprioceptive feedback for that person not to let their thumb bend as much when they're functioning at home. So it's if they really try, they're going to be able to go ahead and bend the thumb through it, but it does help kind of pull back at the thumb and try and keep it a little bit straighter so that as they're going through their day, they're doing their dishes, they're working, they're folding clothes, whatever it is that they need to do, that thumb's not triggering all day long, okay? So I've got my little piece of tape, rounded edges, it's looking really good. We're going to go ahead and make a little rip across the tape about 1 inch of the way down, just like you would for any other tape. You're going to have an anchor, and then just carefully kind of peeling back the edge of the tape. Don't touch the tape, okay? And then we're going to go and attach it to that kind of P1 or proximal phalanx of the volar side of the thumb. So I'm going to go ahead and just carefully attach that, no stretch on it, okay? So this is what we have so far. It's just our little anchor piece, okay? From there, I'm gonna carefully get that paper to peel away a little bit. And I'm actually gonna take like a nice, probably 50 to 60% stretch as I go ahead and pull back over the thumb. And then I'm going to actually attach it down to that kind of P1 again, dorsally, if you can see. And then from there, I'm just going to kind of smooth out my edges just a little bit so it'll stick and stay. And then with the rest of the tape, I'm going to go ahead and kind of just glide it down along the dorsum of the thumb. Let me see if you can see this way is probably the best. Okay, and just kind of peel that back. I don't really do a stretch on this part, just kind of a little longer anchor, and you really don't need quite this much tape, but I like to have a little bit longer tail just so that the tape sticks a little bit better. And now I'm just going to go ahead and kind of smooth it down, get that heat activated in the tape, and just check and make sure they don't have any wrinkles, because you know that underneath a wrinkle in the tape they're going to have a blister eventually, so you don't want that for your patients or for yourself. And so that is kind of our finished product. So you've got all the way along the volar side of the thumb. It's going to swoop over the back, and you can see it's holding my thumb into extension. So if I try, I'm definitely going to be able to bend my thumb through. And if I had trigger thumb, that would cause, you know, that locking, clicking. But it's really helping to pull that thumb back. It's giving me a lot of good, basically feedback, proprioceptive feedback, just not to allow it to bend as much. So yeah, that's what it looks like. I've had a lot of good success with this taping method. I do tell patients you know, this, especially on the thumb, because we use our hands so much, it's probably not going to last that 3 or 4 days. You may only get a day out of it, maybe 2 if you're lucky. But if it's bothering them, it's itching, it's rubbing, they feel like they're getting rashy or anything under that, I go ahead and tell them to take it off early, and then that's something that maybe doesn't work that well for them. But I've had some good success with this in kind of those conservative trigger thumb cases where people are just having a hard time keeping it from locking throughout the day. So it might be helpful for you. Just wanted to show you guys that quick taping method. It's really something that pretty much anyone can do, and if it's something that works well for your patients, you can certainly teach them how to do it on themselves at home. It's definitely something you can do with only one hand. May not look graceful, but you can definitely get that good function on there for your patients. So yeah, I hope you guys enjoyed this video. Thank you so much for watching, and keep an eye out for new content being posted on the channel. Please subscribe if you're interested in anything hand therapy or upper extremity related. That is really our main focus. We're going to be showing a lot of exercises, talking about different diagnoses, kind of going through possibly some case studies. We'll probably do some anatomy videos, all those kinds of things. So if that's something that sounds really interesting to you, please go ahead and subscribe, follow along with me, and I hope you have a great day. Thanks so much for watching.